Hello, everyone. Welcome back to another intern interview. Today, I'm here with my good friend, Lauren, who is also a St. George's University alum who matched into internal medicine pediatrics combined specialty at Louisiana State University in New Orleans. So first things first, Lauren, can you sort of tell us a little bit about how you wound up going to St. George's in the first place and your path to medical school?
Well, I think I always was planning on going to medical school. And when in my undergrad years, I wasn't exactly the strongest student. And for the MCAT, I was definitely not the strongest student. I did not do very well. And at that point in my life and applying to all the U.S. medical schools, I felt very overwhelmed. I was having a really hard time, wasn't getting anywhere. I applied everywhere. I applied like just regular MD schools, and I applied DO schools, and I went to a couple interviews, and it never panned out to be anything. And at that point, I decided that I didn't have it in me to take the MCAT again. So a family friend actually went to St. George's University, and he's like, hey, apply to these schools. And I did, and the rest is history. As comparative to other, Caribbean medical schools I applied to, St. George's for me, at that point in my life, what was important to me was that they went to a lot of different clinical sites, including New York City. And so that's why I ended up choosing St. George's over other Caribbean medical schools.
Very happy that you picked SGU because I was fortunate enough to meet you. And in terms of clinical sites, that's what I tell a lot of students is I get approached with the question often is how did I choose? And at the time, SGU had more rotation spots for their clerkships in places that I wanted to be. Yeah. That's kind of what, pushed me over there towards SGU, because realistically, they're all expensive. They're all on a Caribbean island and they all have roughly the same match rate, CAS statistics. So they're kind of even across the board there. So I think for deciding, clinical rotation sites is a great recommendation.
I think it was clinical rotation sites, and the other thing was match rate, where people matched at that time. Because how we have it available, you can just Google it and it shows up. So that was the other thing that I looked at.
Yeah, that's really good to look at in advance as well. I try and tell people to do that now because that's something I wish I would have done, and I didn't. I kind of just went off the clerkship sites, but thankfully, we both did that since we did our clerkships together.
Yes, we did.
In terms of Medicine-Pediatrics, how did you decide on choosing the combined specialty of med-peds? And kind of going off of that, why didn't you choose family medicine, which encompasses a lot of internal medicine and pediatrics?
Okay. So med-peds is basically you're an expert in both fields. You are dual boarded, you are a pediatrician, and you are an internist. So you ultimately can go into any specialty you want that encompasses those two fields. But you also can just practice as a dual physician, which is great. The reason why I chose medicine and pediatrics was because I wanted more pediatrics than would have been available to me in family medicine, because I think really they only have about 6 months total. Where in med peds, we are basically a 6-year residency shoved into 4 years, and with equal amount of time on both. So a lot of family physicians aren't necessarily comfortable treating pediatric patients, and I really love the pediatric population a lot. And like I was telling the fellow today, I love medicine, but in a very different way. So that's why I chose med peds. And the other thing about family medicine that didn't really vibe so great with me was that I would have to do OB again and surgery, which for me, if I never have to walk into an OR again, that'd be fabulous.
True when they say you're an OR person, and when you're not an OR person,
Oh, I know. I'm very aware of what.
And so in terms of medicine pediatrics, I feel like I didn't even know about this until you decided during third year that that's what you wanted to apply for. So where did you learn about the combined specialty from?
Well, I actually learned it from Madden's lecture that we had term one, when everyone was having a panic attack, including myself. He had that graph that he put up with all the step scores, and then at the bottom all the specialties. And so I was just trying to not freak out in the middle of this, reading all the specialties, and there's this one that said IMPs, and I was like, what the heck is that? Because at that point, first of all, I probably did not really know what I wanted to do when I first walked through the doors of St. George's and sat down in a classroom. But I knew that I wanted to do like some type of clinical medicine, at that point. But then I saw Med-Peds. I ended up on the Med-Peds, like the official resident association website, which is NAPRA. And I started reading, what it was, what about, and I was like, oh my God, this is amazing. I get to do medicine and peds. And the funny thing is about Med-Peds is the way that they describe it is medicine with a hug and pediatrics with a slap, which I think is the greatest explanation for Med-Peds. So yeah, after that, I just started doing like more research. And then as we got more serious, like when we started applying for residencies, I basically just looked on, what's that residency search website where you can like look at all the different programs? Yeah, Frida. So I basically just searched Frida for all the residencies that have accepted IMGs in the past. And then I just mass applied to those because unlike other programs like medicine or peds, Med-Peds only has less than 80 programs. So unfortunately for somebody like us, we really have to mass apply. We're like my fellow colleagues who are US medical graduates, they probably applied to 15 programs maybe. So it worked out. Like I matched Med-Peds, and we're not I don't think Med-Peds are anti-IMG at all. But you do require a higher level in your step score as compared to somebody who is just matching medicine or just matching peds. I know you're gonna ask me that question. So.
No, that's okay.
Yeah.
Is there anyone you were able to reach out to or that you knew of who had previously matched into Med-Peds for any advice before you applied?
So I didn't personally know anyone, but you know how when you go to the match list and some people's names light up? So what I did was I just looked through the last most recent years, and I clicked on a couple of people's names, and I sent them kind of emails of hey, is there anything that I need to I should be doing before I apply? And that was third year, I think, that I did that. And they some people did get back to me, and they just kind of said just do well in medicine rotation and the pediatric rotations, which made sense, and just do research into the programs that you're interested in. And for the most part, we were okay. We were okay in clinicals. We had we had great medicine. We had great peds. So those were pretty good rotations for us. And it wasn't I, was breaking myself during that period of time.
Yeah.
Yeah.
So you found that when you reached out through the match list website on the SGU website, and you thought the response rate was pretty good.
Yeah. In general, I didn't actually meet an SGU Med-Peds graduate until I was rotating in fourth year, afterwards.
Okay. Yeah. And then in terms of just preparing your application during ERAS, was there anything specifically in basic sciences you did to help strengthen your application to match into Med-Peds, or were you just unsure at the time that that's what you wanted to do and you were kind of open-minded?
Well, so after I kind of semi-decided in basic sciences that I was pretty interested in Med-Peds, obviously I didn't know all of that, what that entailed. So the only thing that I really focused on was doing well on STEP, because STEP was going to be kind of my golden ticket into Med-Peds, and seeing the averages and knowing that, what they say about us is we have to score 10 points above the US average. That was my main goal. That was what I focused on. And actually, I did achieve that, which was great. But
Good.
that was, that was really the only thing that I really did focus on at that time because, I didn't know anyone in med peds.
Yeah. And I think that's important that you bring that up. Like, obviously, there are many other important factors other than the step score to an IMG's application. But the fact that you do well on step one kind of puts you on an even playing field with everyone else who's applying from the US. And it basically like proves that you belong there just as much as any other applicant. So I think that's important that you brought that up. Is there any volunteer work that you did when you were in Grenada or not so much?
Not anything that was like med peds related. Honestly, I was just trying to, like, after what happened to the MCAT and learning how to study again and actually study effectively, that was my primary focus when I was on the island, at least.
Yeah, I think that's a really good point too, because a lot of times people reach out to me saying, how can I enhance my application? And it is good if you can get in like a very low key, like volunteer activity that's not taking up too much time, but ultimately your main focus should be step one and doing well in school, because that's what's going to put you on an even playing field. And you have your time is structured a lot differently in clinicals. And I think that there is more time to do volunteer work during clinical years. And I think it's also a little bit easier to make those connections and get volunteer opportunities and stuff, even research opportunities, like when you're in the States opposed to when you're on the island. I think it's a little bit easier. So.
Oh yeah, for sure. And it's like, even that, like, I mean, research is good, obviously, overall, but during basic sciences, like you really just don't have like the clinical understanding to really do well. At least, I mean, I'm not an academic person, so I don't want to do bench work. So any kind of research I want to do, I want to do like a paper, just like a quick thing about a patient, a case study, And so on the island, that's not an opportunity we really have.
Yeah, that's actually a really good point. I never thought about that, but you're right. In order to do any type of clinical research that you would want on your application, you do need a foundation. The only place you're going to get that is basic sciences. I never thought about that. That's a really good point. Really good point.
Yeah.
In terms of clinical years, is there anything you did that you felt enhanced your application to help you match into med-peds?
Well, I tried to do as well as I could in medicine and in peds without going over the top. I mean, obviously, our medicine rotation is our family. They'll always be our family. And we just got along really well with them. And they wrote me very strong letters. For peds, I mean, peds is great. I tried to be as involved as possible without trying to overstep my boundaries with my fellow pediatric medical students. I mean, I was really lucky because the people who I were with didn't want anything to do with pediatrics. So I got to do all the things, and I was super gung-ho about it, which is fantastic. But like, I didn't really do anything in addition, I would say, to just trying to perform well in medicine and peds and trying to get strong letters from those respective departments. That was pretty much my focus.
I think something that kind of helped us in the medicine aspect is that our group was so small. I think it is sometimes a little bit more difficult, like when we didn't do pediatrics together, but we did it the same place, had the same amount of people in our group. And I think it was a little bit more difficult to try and stand out amongst a larger group opposed to the smaller group that we had in medicine. So I think that we were very fortunate in that aspect to have a smaller group of students for medicine, because it was great to be able to build those relationships and make connections. And but okay, so going back to, you mentioned letters of recommendation. Was there anything you specifically did during rotations to help, whether in medicine, pediatrics, or both, that you did to help you stand out and get a better letter of recommendation than average?
I mean, I would be honest. I would say, I want to go into med peds. And like, at least on the East Coast, it's not a very well-known residency program at all, so you kind of have to explain yourself. But there are pockets of people who are med peds and like have been trained med peds. But as far as trying to make myself stand out, Not really. Like, you know me. I just tried to do my work and be present in those moments that we were teaching, with the exception of surgery. We're gonna let that one slide.
Yeah.
But like in peds and medicine, like I try to interact in those like learning sessions in order to, I guess, stand out. As far as letters of recommendation goes, I felt very comfortable asking the medicine people, I'm sure you did too, for letters of recommendation, just because they work with us every single day and they knew us so well. And so I think they also felt comfortable writing us letters because they knew me, they knew what I wanted to do. And then I just happened to get really lucky with peds and have Dr. Kreda, who was like, if you really want to do pediatrics, I will interview you and we can talk about it and I'll write you a letter. And so I was really fortunate. I wasn't trying to like bang down doors to get letters of recommendation.
Yeah.
So that was really great. As far as what you would need when you apply for Med-Peds, most programs will require at least like 2 letters, and they want them from the respective department. So like medicine or peds. And then I did 2 medicine and 1 peds. Some programs will require like department head papers from either department. Like you don't need to get both.
Okay.
So I think I ended up doing the Department of Peds because I already had the 2 medicine letters.
Okay.
Yeah.
So just so people watching know what we're referring to in terms of the department letter is for the department chair. And some programs will require this. You have to go on their individual websites to find which programs require this letter. And it is not the same thing as the MSPE/Dean's letter. The MSPE and the Dean's letter are the same thing, but the department chair letter is something entirely different. And you have to reach out to your school to obtain said letter. For SGU students who are watching this, you reach out to your MSPE coordinator during your 3rd year, and they will make sure that you get a chair letter if you need one. For students who go to other institutions or who are in other institutions throughout the world, just contact your school and you'll probably be able to figure out who the chair letter is, or someone will be able to tell you who the chair is so that you can get that letter. But it is not the same thing as the MSPE/Dean's letter. MSPE and Dean's letter are the same. This is something different. And what Lauren is saying is that in Med-Peds, you don't need a department chair letter in Peds and Medicine. You just need one of the 2. They don't care which.
But it's not every program. It's only some programs. Like I know Baylor, I think, was one of those programs that I sent a department chair letter to. But you have, like you said, you have to physically go onto their residency website and see what they the requirements for your application.
Perfect. And that's something that I think is important to bring up because I myself didn't know about this letter until like a few days before submitting the application, and I found out last minute. So I was freaking out. But here we are, all is said and done, all well, and I freaked out for no reason. Also, in terms of letters of recommendation, just some tips for trying to obtain a good one. I think as someone who rotated with Lauren, something that I think she did very well was she took a lot of initiative and she knew her patients inside and out, arguably sometimes better than her resident. And I think that spoke volumes, and attendings definitely recognize that. I did medicine with her. I did not do pediatrics, but I will assume that she performed the same way in pediatrics as she did in medicine. And I think that is one thing that helped get her a strong letter of recommendation because it was definitely evident that she knew her patients inside and out. What color their dog was, what their potassium was, literally everything inside and out. So things to note. We talked a little bit about step scores before. And so I know you mentioned that you wanted to do 10 points better than the US average, roughly, to make sure that you were on the same playing field as everybody else who was applying from a US MD or DO school. And it looks like the data I found, it says that the low to mid 230 seems to be the average step score for successfully matched applicants into medicine peds. Does that sound about right?
Yeah. So when I looked at it, however many years this was before, I think it was like 234, 235 or something like that. I know that it was above what medicine was, and I know that it was definitely above what pediatrics is. so yeah, that was the goal, just to score at least 10 points above that. And I was able to do it at the time. I don't know if I could do it now though. But at the time, yes, I was able to do that. And it was a very thrilling day to get my steps going. Like, oh my God, I finally have broken the curse of the MCAT and I scored what I needed to do.
Yeah.
So that was fun. But yeah, so as far as studying for STEP, I mean, I don't know. Everyone's different.
Yeah, agreed.
Mm-hmm.
Agreed. And I feel like everyone pretty much uses the same resources. UWorld, Pathoma, a little bit sketchy here and there. UWorld,
Oh, yeah.
UWorld, more UWorld.
Let's be honest.
When you break it up is up to you, but it's all the same.
I still use like sketchy in my mind for micro and farm. Like, how do I remember things? So just because it's sketchy.
Definitely pictures. Pictures are definitely helpful. And then you also mentioned about research earlier, how you wanted to do some clinical research and you felt as though in basic sciences, you didn't have that foundation to the extent where you were able to understand clinical medicine and do a research project on it. Did you have any research when you applied to Medicine-Pediatrics or no?
I didn't have any from medical school. I was published when I was in college. And so it kind of like didn't get published until 2017. So it worked out that I could put it on my application. Right. But no, I didn't actually have any like case reports or anything. We had opportunities. Like I know that in medicine, there were people who were working on things and we probably could have jumped on them. And in peds, probably, but I wasn't as comfortable with like the pediatric residents to do that. But I also honestly was just trying to get through third year.
Yeah.
At the time, I was like, okay, we're going to keep our head down and keep going.
Yeah.
Yeah.
And you mentioned you did have some from undergrad. How, just out of curiosity, because I had some from undergrad as well, on all the interviews you went on, how many programs asked you about your research?
One.
This is my favorite question to ask.
And it wasn't even med-peds. So take that with a grain of salt.
Amazing. So like I say, I'm pretty confident in the fact that for a lot of the primary care specialties and even arguably non-primary care specialties, with the exception of like urology, plastic surgery, orthopedics, who you definitely need some research for, you're not going to get looked at. A lot of specialties, you don't need research. It will help you, but not having it can't hurt you. I don't think. I
mean, so. I would say if maybe you're like interested in like an academic program, they might be more interested in your research. But I mean, for me, like I didn't really apply to like academic programs, so.
Yeah. You mentioned you didn't apply to just Medicine-Pediatrics because there are only how many programs?
Less than 80.
Less than 80. And as an IMG, of course, they want you to apply to 100 or more. So did you apply to any secondary specialties? If so, what did you apply to?
Yes. So actually the majority of programs I applied to were medicine. Okay. I think I applied to like 50 medicine programs, and then I probably applied to like 47 med-peds programs. And then I think I rounded it out with like 6 pediatric programs. Because at that point, I was like, if I don't match med-peds, what do I want to do?
Right.
It was a hard decision. And I decided that medicine would be a better fit for me overall than peds.
Okay.
Whether that is true now, I don't know, because I'm really enjoying the combination.
Yeah, I was going to say, and it doesn't matter because you get the best of both worlds now.
Yes, I get the best of both worlds. I triple applied because they made us very nervous. They definitely made us very nervous, and I applied to 115 programs, which was probably way too many.
Yeah, that was going to be my follow-up question, actually. Do you feel like it was too many, or do you feel like it was spot on?
Oh, no, way too many. I ended up going to 17 interviews, which was a lot. It was absolutely exhausting. And, I mean, the majority of them were med-peds. Basically, if I got a med-peds interview, I went to that interview. Like, that was my goal. It doesn't matter, like, what I was rotating on or whatever. Like, I just made it happen. there was only one Med-Peds interview that I didn't go to. But I also at that time was like, if I matched into this program, would I really want to go there? And the answer was no. So I did not go to that interview.
So ultimately, go ahead.
Didn't matter because
it doesn't matter. You are here. You are in medicine pediatrics, and you are at what I believe is your number one choice. So that's even more exciting.
Yes, it is.
So most of it sounds like what you did was you applied to all the medicine pediatrics programs, a large amount of medicine, and some pediatrics. And then the way you picked your interviews was you wanted nothing more than medicine pediatrics. So you went on all of those that you were invited to, except one. And then between medicine and pediatrics, you sort of just picked, would I be happy here? If the answer was yes, you would go on the interview. If the answer was no, you would just leave it at the med-peds interviews you were going on.
Yeah, so medicine came out with their interview invitations a lot earlier than med-peds. And as pediatrics also did. So I think I ended up going on like 2 pediatric interviews. I definitely went on more medicine comparatively. I think I went on like maybe 4 medicine. But the majority, like 10 of them were med-peds. So,
perfect. And then, hold on, I forget what I was just going to ask you. Oh, in terms of rotations, there's obviously no audition rotation you can do for medicine pediatrics, but did you either audition anywhere for medicine or pediatrics that had a med-peds program and you were interested in going to?
Yes. So Rutgers has a med-peds program. And it's actually Rutgers now. It used to be separate. It used to be Newark, Beth Israel, and Rutgers. But they have very small programs. They only have 2 people in their program. And now it's 4 because it's combined. But I didn't know that they were going to combine because they combined our year when we applied. So I did go to Newark, Beth Israel, and I rotated through a pediatric department rotation and a medicine department rotation. Whether I choose the right one is up for debate. But I enjoyed those rotations, so that was good. And it kind of reaffirmed that I like this crossover between the two. But I didn't it probably would have been nice to actually have a med-peds audition. I just didn't, you know how crazy things were 4th year and scheduling things. So I wasn't willing to go to a different program and do an away rotation because I didn't want to spend the money because I wanted to spend it on traveling for interviews and for applications. So that was my decision. I think that if somebody was interested in med-peds and they were really considering it and they could do an audition rotation, the best thing they could do would be go to a combined med-peds clinic. That is a great opportunity to see, these med-peds doctors in action in a very nice controlled setting, because you're not, the chance of you actually being in the hospital with a med-peds attending is probably pretty limited. So.
Yeah. And if someone wasn't able to obtain an audition or even just an elective at a med-peds clinic, do you think there's any value in doing an extra elective in family medicine and perhaps getting a letter from them as well, since they can work with both patient populations, or not so much?
So I'm not sure because we didn't really have a true family medicine rotation. But I would say if you can, do something in the medicine department and do something in the pediatric department at that rotation site that you can, if they don't have med-peds.
Right.
Or if they do have med-peds, but they don't offer an audition rotation. Just so that, because you will probably run into a med-peds person on either side of, med or peds.
Right.
And you can chat them up and it's great. And actually that's what happened when I was at Newark Beth Israel. One of the people that I ended up interacting with was a 3rd-year med-peds SGU student.
Oh,
so
wow.
So that was really great. And he kind of made me feel a lot more comfortable because it was literally right when we were submitting our application.
Yeah.
So that was really great. And my favorite question is to ask other med peds is like, why did you choose med peds? And generally it's pretty similar to what I said, but it's always interesting to see what everyone else kind of comes up with.
Yeah. And I think the other benefit, like you said, you didn't want to have to go through OBGYN and you didn't want to have to go through surgery. And then I feel like because you don't have to go through those with med peds versus family medicine, you do get to delve a little bit deeper into the hem-onc in peds and the GI in adults and the pulmonology in adults and the GI in kids. Like you get to go into each system a little bit deeper, which I think is very unique to that specific field because that's a lot of material to cover in 4 years.
Oh yeah, for sure.
So moving on to interviews, which is one of my favorite things to talk about because interview season, albeit exhausting, was like relatively fun. I feel like I had some good conversations. Saw a lot of cool places. What were the most commonly asked questions on your interview trail?
Probably, how did you find out about med peds? That because it's not common and most people don't know what it's about, and it's like, well, how did you come to this point? You know, like where did you find this?
True.
They also would ask me, you know, like what do you want to do in the future? I'd say that's probably what they asked me. Other things, I mean, those are like the main ones that they would ask me, and probably like, you know, what do you think about our program? Like, how do you see yourself fitting into this program? So that was good too.
Things like that. Also on interviews, what is one thing that you think helped you stand out as an applicant? And what do you think that programs were looking for in a Medicine-Pediatrics applicant?
Honestly, my med peds interviews are some of my favorites overall. I felt like I wasn't being interviewed in the sense that they were testing me, but rather if I was a good fit for their program. Every med peds interview felt like a family meeting and like getting to know everyone, it was really comforting at the time to like go to these interviews and go like far away from like where we're comfortable and get to know these people who could potentially be your colleagues. And so that's kind of what I looked for when I went to interviews, like how comfortable I was in that space, especially with the program director. Like, so to stand out, I don't know, you know, I'm kind of weird. I always wore my crazy socks because that was one of the things that I put down of like my interest was collecting socks. And so I always wore my crazy socks because they actually started checking one interview, I wasn't wearing like my craziest socks. I was just wearing like some socks that had some flowers on it. And they're like, I was looking and you didn't wear any fun socks today. And I was like, I guess I'm going to have to do that from now on.
Just in case.
Just in case. Other things that I would kind of make myself stand out, you know, I just really expressed my interest in what I wanted in a program to the program director or to, you know, whatever other faculty was interviewing me of like, you know, this is like, how are you guys in this scenario? So for example, for me, I really like clinic. I like community outreach. That's important to me. And so I would inquire about that. And actually here at our program, we have a community place we're not allowed to rotate yet because we're still only interns, but next half of the year, we're allowed to rotate, and it's like once a week it's like a free clinic, which just sounds amazing to me.
Oh, that's great.
Yeah, so that's
I also love primary care.
I know. So that was like part of their community outreach that they do. Obviously, things are a whole lot different now with like coronavirus and stuff. But yeah, and then other things that were important to me were like clinic, like we said. And for me, I didn't want to go to a program that was going to be clinic only medicine or clinic only peds. I wanted to combine clinic, and I have to say my clinic day is my favorite day of the week. It is.
Well, that's good to hear. That makes me so happy.
Yes, it is fantastic. I love going to clinic. My best notes are written in clinic for sure.
I also love clinic. Is that, I know you mentioned before that you are eligible for both fellowships in medicine as well as pediatrics when you graduate. Are you interested in doing one of those, or are you interested in doing primary care?
I don't know. I have to say I love clinic a lot. I do love it a lot. I don't know at this point if that's the only thing I want to do for the rest of my life. But there are a lot of opportunities for med peds. Like, there are people, like, honestly, I met a graduate the other day. He's doing adult cardiology right now. Other people I know who are going to go into PICU. But yeah, I mean, you ultimately can do whatever you want. There is one true med peds fellowship that isn't really med peds, but it encompasses med peds. So allergy immunology is actually a truly combined fellowship that is just normally combined. So if you're med peds and you go into allergy immunology, you got like a step up from everyone else.
That's pretty cool. I never knew that.
Yeah. Mm-hmm.
That's interesting. Wow. So it's like you have three options: adults, children, and still combining both.
Yes, but actually they do have like med peds hospitalist programs. If you are interested, I know like my fellow interns, they want to do like developmental cardiology because that's like a huge area that lacks a lot of like doctors. Right. And then being med peds you can continue to see your patients.
Right.
That's really what a lot of med peds people want to do if they're going to do fellowship. They want to be able to see people through that transitional care. So yeah, and people actually will, like when they apply to fellowship, they'll ask like programs to be like, hey, listen, like I'm trained med peds, I'm interested in do this like combination, but you have to be very proactive and you have to kind of like put it together. But some programs are open to you kind of doing the crossover. It's probably just a lot more years, so I don't know.
Yeah, med peds is already 4 years.
It's already 4 years. If I was to do a fellowship and then do like 2 fellowships on top of that, like I'm gonna be like 45 by the time I'm done.
Before you're practicing on your own.
Before I'm practicing on my own.
And then going back to what you just mentioned, also, I remembered what I wanted to ask. In terms of finding where you felt you fit the best. I think I just wanted to make a comment on it because I think that's something that not everyone takes into consideration. I think a lot of people are like, oh, it's a one-way street. I need to match, but it's really a two-way street. You need to match, but they need to fill their spots. And they want to rank people who are going to be happy there and who they're going to be able to help reach the goals that they have. And if you're applying somewhere that doesn't have a combined Medicine-Pediatrics clinic like you wanted, and there's a program you interviewed at that only had medicine, perhaps they knew that they weren't going to be a fit for you. So I think just keeping in mind that ranking is like a two-way street is super important. And then I think for med peds, it sounds like it's super important because yes, you want to interview well and, you know, be everything that a program wants, but it's important for you to realize that, like, in my situation, it's a little different. There are 55 people in my program. I'm bound to get along with somebody. Whereas like, medicine-pediatrics programs tend to be a lot smaller. And while there are medicine residents and pediatrics residents, you guys usually tend to, you have your own niche and you kind of, you know, bond with one another. You guys have similar interests, unique interests. And I think that making sure that you're not a fraud on interview day in terms of like your hobbies and your self-characteristics is something that's actually important because you want to get along and have similarities to your co-residents because you're going to be spending 4 years with them, 80 hours a week. Like that's a long time to match somewhere where you're not going to get along with anybody.
And I wanted a good support system, and I have to say I have a good support system. They are fantastic. I love all of them. Like I said earlier, we kayaked on Saturday together. It was fantastic. They're very much like me. I was very concerned that they would be more like peds or just medicine and they doing this combined put, but no, we're like all in it to win it together. We bonded a lot during orientation week. We've hung out a couple of times. Unfortunately, we don't all get the same weekends off. Yeah. But we have a group message just for us. We're always texting. I love all of them. They're great. I see one of them in clinic every day and it's fantastic. But even like the other med peds residents that I've interacted with, have been really great. But when
like upper years.
Yeah, the upper levels. But when I went, like, for this particular interview for LSU New Orleans, it was good because prior to the interview, we actually, like, you know how they do like a dinner beforehand?
Yeah.
So actually for this program, we don't really do a dinner beforehand. They do a potluck at one of the residents' houses.
That's
and
nice.
So it's literally a party.
Yeah, that's like a little family.
It is a family. Like, people bring their kids and their spouses, and our program coordinator's there, Vilma. Bless her heart, she is the sweetest woman I've ever met. She's amazing. But, like, that's the thing. Like, I get along with my program director, my APD, and my program coordinator. So
important.
They're all amazing. And I felt immediately comfortable when I met them on the interview. Now it's like a whole other level. Like, I just, like, it's awesome. So and there were definitely interviews I have, even med peds interviews, where I didn't vibe with the program director, which was very important to me, because somebody once told me, they're like, you should really look to leadership.
I think that's a fair assessment. Yeah. That's a great point. And even if you can't get a good read on what the program director is like, you can still look to see what that leadership is like by getting a sense of it from the residents. So make sure you ask a lot of questions about how the leadership of the program is, how, like, if there's any formal feedback or anything like that, because I think those are not only really good ways for you to learn, but also it's like they're directly invested in your well-being.
Oh, yeah.
But yeah, so the last question I have for you is, what do you think is the biggest challenge you face as an IMG in the application process?
Imposter syndrome. Honestly, like, because with med peds, at least, like, medicine and peds are different. They have a lot of IMG applicants that I saw along the way. But med peds, if you're an IMG and you want to do med peds, like, I don't think a lot of people apply. Like, for us, we matched 6 this year from St. George's University. And I only saw one of them on the interview trail.
Yeah. No, I think that is something to take into consideration too when you're applying. Like, I think, especially because Medicine-Pediatrics is more competitive than primary care specialties, given that it's a combined program, but ultimately it is still 2 primary care specialties. So I think considering how many people actually apply, and even considering how many people know about it, because like I said, if you didn't apply for it, I honestly might not have known that it existed.
Right.
So
I mean, there's like, I think there's like a little less than like 400 spots total, and only a little over 400 people apply. It is not a very common, you know, area. And like, the majority of the med peds programs are in the South and the Midwest. That is where the strongholds are. Because, I mean, it makes sense. That's where they probably need the most kind of like overlap, the most combined, because they don't have as many internists or pediatricians like in the area.
That's a good point.
But yes, don't be worried about the numbers. It's very daunting to see, yes, 16 IMGs matched into med peds last year, okay? But how many actually applied? They never tell you how many applied.
Yeah, I agree. And I think it's one of those things where it's like, oh, if you look at derm and you see that, oh, only two IMGs matched into derm last year. Okay, well, that's different than, okay, 16 people matched into med peds, but only like, 22 applied, if like just for making up a number. But I think it would probably be more similar to that than, 50 IMGs apply to derm and only 2 match, because derm is notoriously known for being not so IMG friendly, and not even just not so IMG friendly. It's just super competitive for US students alone,
in general,
let alone throwing IMGs into the mix.
But like for me, my program, we have IMGs in every single year. So it's like, there's a lot of IMG friendly med peds programs. As far as like, how many interviews and stuff you should go on, I think 10 was sufficient for me. but I don't know like what other people. I think like you really should get like upwards of 10 programs is like how you feel comfortable with matching.
Yeah.
And then the most important thing when you're ranking, you need to rank your med peds consecutively. Don't be putting the other programs in there, because if you really want to match med peds, you gotta rank those consecutively.
Yeah, I think that's really good advice, and that goes for any specialty, really. Like I know from people I know and from people who've like mentioned their experiences in the past, the best thing you can do if you want to match into a specialty and you want nothing more than to match into that specialty, rank that specialty consecutively. Don't rank, oh, well, I would rather live in Florida than go to this program. That means that you don't want anything more than to match into that specialty, because you're considering location as an alternative factor. If you want nothing more than to be duly certified in medicine and pediatrics, then you have to rank all of those programs first. Rather than risking, being only certified in one of the two, if you apply to one of the two as your secondary specialty.
Yeah. And med peds is kind of like unfortunate when you are ranking things, because there aren't many spots in all these programs. Like I'm technically at a large program, like 6 interns is a lot. I would say the average is 4. I went to interviews, there were only 2 spots available, which is absolutely terrifying because you're interviewing with like 15 other people. So yeah, that's just something, that's something to be aware of when you are ranking your program. Because like medicine's a lot different. You said you have 55 people in your intern year.
Granted, it's not a large program, but yeah. Even like a smaller program is like 10, 12, which is still bigger than your large program.
Big. So, yeah, exactly. So it's it's a numbers game. But don't rank a program just because they have more spots if you're not necessarily more comfortable with that place.
Yeah, rank based off of your gut feelings.
Yeah.
You will probably make a large PDF document or Excel spreadsheet with all of the factors and weigh them, and then you won't even use it. You'll go based off of your gut instinct anyways. You'll do way more work than you do.
I did use that app though.
True.
I like that app a lot. I don't remember what it's called.
I think it was called NRMP Prism.
Yeah, the Prism, that's what it was. Yeah, I like that one because there was like, I would say I knew my top 3. I pretty much knew my top 3 after I went to those interviews, but then things would move around below that. And so I like the Prism app because then it helped me kind of formulate my thoughts in a more objective manner.
Yeah. Mm-hmm. Yeah, I use the app as well, mainly for the same thing. It's like, I knew which programs I wanted at the very top, and I knew which programs I wanted like closer to the bottom, but like the middle was a very like gray area for me. So I think, looking at them objectively was definitely helpful. And I think you were the one who suggested the NRMP Prism app to me. So
really?
Yeah, you're the one who told me about it. I used it after that.
I wish I had known about it earlier. I found out about it like in January, which was pretty much when we were finished with our interviews.
Ready to rank.
So ready to rank, which was fine because yes, it helped me rank, but it would have been nice to kind of like do it right after the interviews. Cause you know how everyone's like, always take notes. I never took notes. Like I was the worst.
Yeah. See, the thing is, everyone says always take notes. I took notes, didn't use them. The only thing I would say I did that I found helpful is instead of writing down like call schedule frequency and meal stipend and step 3 stipend, like instead of putting down dumb stuff like that, which I didn't even use to make my rank list, obviously, but after every interview, just writing down my initial gut reaction, like 2 or 3 sentences did come a long way. I feel like when I started ranking like in January, February. Just because they all start when you go on so many, like 17, I think I went on like 20 also, and it blends together. It's just like, I don't even remember the hospital tour. Like they all look the same, they all sound the same. I don't remember. So
I hated hospital tours. They were like my least favorite thing.
But the virtual user won't have to do that. I'm kind of jealous.
I know. So, but I didn't take notes for anything, and it was definitely more of a gut feeling than anything else.
Yeah, I agree.
Yeah, that's really what it. I mean, I love New Orleans. Like, I love New Orleans. I love the city. It's just really fortunate that I also really love this program.
Yeah, I think that is kind of the same situation I'm in. Like, I knew I loved Philly. I would have loved to be back here, but I wasn't going to sacrifice coming here to go to a program I wasn't necessarily happy at. But fortunately, I found one that I was happy. It was also in Philadelphia. So,
yes.
Lucky us. Lucky us.
Yes. Hey, we earned it. We worked heckin' hard.
We sure did. Sure did. Came a long way from August of 2018 when we first stepped onto the medicine floor.
Oh, Lord. Yeah, it's great.
But just so we can chat more, so I don't have any more questions for you. Do you have anything you would like to share in addition to everything I asked you already?
No, but you should come to LSU New Orleans if you're really considering med-peds. It's great here. Everyone's fantastic.
You can make a connection now with Lauren.
Yeah.
Click on her name on the SGU website and you can email her.
Yes. You could also email me at my LSU email, which I probably will get, which is LDELEON. No N at the end. So it's LDELEO at lsuhsc.edu.
And I will put it in the video description below so that they can email you if they want. So email Lauren. I will put her email address below, and then I'll also link the SGU Match Directory so that if you want to reach out to her on there, you can click on that also. Her name is highlighted in blue under Medicine-Pediatrics next to LSU New Orleans. So thank you so much, Lauren, for taking the time to do this. I know your schedule's super busy. Residency has been very hectic so far, so I appreciate you sharing all of your tips and tricks and knowledge and answering all my questions. I know that this will benefit a lot of people, so thank you.
Fantastic. Yay.